Diagnosis alone constitutes the bulk of EM practice and permeates every part of it. Misdiagnosis is surprisingly common. Per numerous studies, the overall observed or measured misdiagnosis rate is about 10 to 15%. And as explained in this article, the unobserved, unmeasured rate is surely much higher. To arrive at a correct diagnosis, a physician needs to know which diseases to consider, which findings or disease manifestations to look for, and the significance of finding presence or absence. In other words, finding specificity and/or sensitivity. Humans, including physicians, can't always recall that information when needed. Computers can always provide it. The HIPAA system uses colors to convey finding specificity and/or sensitivity, the hardest info to process. Humans process colors extremely well. They do so without having to even think about the meanings of the colors. Without colors, physicians can't always process that info when needed. With colors, they can do so quickly and easily. Dr. Carol Rivers, whose preparatory textbooks helped thousands of doctors become board certified, strongly endorsed use of the HIPAA's color-coded interface. She stated in part, color coding data allows the user to learn more and remember more so that with repeated use, he not only increases his knowledge base but also becomes more sophisticated academically and clinically in the decision-making process. In other words, by using the program, the physician becomes more astute in his clinical practice. Dr. Mark Graber, an EM professor who pioneered efforts to improve diagnosis, rightly noted, diagnostic expertise, more than anything else, defines the medical profession. An ED nurse put it more bluntly. He said, every time a patient comes in with chest pain, all that doctor does is order a cardiac profile. I can do that. If physicians will let computers help them process diagnostic info and excel at doing what only humans can do, which includes determining reliably finding presence or absence, especially history and physical, interpreting test results, and using human judgment and experience in other ways, they can be better diagnosticians and thereby secure a better place for themselves as physicians in the rapidly changing world of healthcare, and increase the value of their professional service. Without colors, the system would need to use a fairly large number of black and white symbols such as these. Black and white symbols don't easily convey that info, and their meanings can't be easily recalled by a doctor, especially while performing other needed tasks. Color-coded symbols let him study and then process that info at the bedside without having to even think about the meanings of the colors, and therefore with indispensable ease and speed. Before using this menu to consider the implications, a physician can work through all the findings for a set of diseases simultaneously. He can do so for even a large set, quickly and systematically, by using finding primary colors to determine presentation order. Purple findings, if present, get rid of the garbage. For example, if the finding male gender is present, the patient has no female disorders. Orange findings always or almost always occur with each disease, and therefore, if absent, rule out most others. And if present, identify one or more likely possibilities. Green findings, if present, are diagnostic, but if absent or non-existent, or if determining presence or absence is costly or risky, yellow findings can be used to identify the most likely possibility. Green findings might then be used more cost-effectively. In short, color coding is the missing cog which makes the whole system work.